AstraZeneca is a science-led global pharmaceutical company. We are pushing the boundaries of science, deliver life-changing medicines to drive enduring benefit for patients, society, and the planet. We are working across different therapeutic areas, tackling and delivering better outcomes, primarily in oncology, in cardiovascular, renal and metabolism, respiratory, immunology, vaccines and immunotherapy, as well as rare disease areas. Our focus is not only tackling and working on the small molecules, but also novel therapies like biologics, immunotherapies, and also heavily research and development practices. If you look at Indonesia, AstraZeneca Indonesia, we are contributing to Indonesia for the 54 years. And even in the last 2 years, we are doing 5 real-world evidence studies in Indonesia, and we had previously 5 phase 3 studies in Indonesia, and we are working on how we can deliver more. In the 54 years, we delivered more than 60 innovative medicines. We are also working hand in hand with the government authorities, BPOM, Ministry of Health, how we can strengthen the healthcare ecosystem, contribute and train healthcare professionals primarily in the puskesmas, non-communicable diseases, and we have so far trained more than 1,000 puskesmas practitioners on asthma and COPD. We also believe in the sustainability of the environment. One of the initiatives we are doing for many years, we are investing in youth, creating healthcare awareness. So we so far engage more than 87,000 young health on how they can become healthier, healthcare awareness so that we prevent the diseases. Not only that, we also believe in the connectivity of healthy people, healthy society, but also healthy planet. Because of the environmental problems arising in the global level, we invest in the planet and environmental problems as well. Only in Indonesia, through our AstraZeneca Forest program, we have planted more than 11 million trees around the Citarum River area, contributed to the reforestation. Not only that, we also trained more than 70,000 farmers on how they can do sustainable agriculture. We also converted all our fleet to 100% electric fleet so that we reduce the carbon emissions through our zero carbon program and ambition. In a nutshell, we believe the health equity is very important for every nation, as well as Indonesia. While we are developing innovative medicines, we also truly work in hand how we can make sure we can access to more patients so that we can make a big difference for our health and community.
The key challenges that we're facing right now is research and development, as Bu Rizka and Pak Taruna said before. So what are concrete contributions has AstraZeneca made to support local capabilities, especially in terms of clinical trials, research, and technology transfer?
So AstraZeneca is one of the biggest global biopharmaceuticals, and we have enormous pipeline. We have one of the biggest pipeline, especially in oncology, in cardiovascular diseases. Even after the acquisition of Alexion, we also have growing pipeline in rare disease. So we are trying to bring as much as clinical studies to Indonesia. We had historically 5 clinical studies in Indonesia across different therapy areas in gastrointestinal diseases, in cardiovascular diseases, as well as different therapy areas. In the last 2 years, we also invest a lot in the real-world evidence because there is a lot of data gaps. What are the true barriers in the healthcare ecosystem, particular areas in diagnostics, so that we find solutions and work together? So we are also doing observational studies specific to the Indonesian population, working with the association key center of excellences to bring more information that supports the data and analytics to help to find solutions. We also very happy to see the INA CRC, development of INA CRC. Also, we are recognizing the efforts that Ministry of Health is putting, how they can ease the process to bring more clinical trials, and we truly appreciate. And I believe we will bring more and more clinical trials to Indonesia, easing the regulatory, also clearer definitions, and we are working on more feasibility studies to bring so that we can embed more.
Okay, so we're talking also about ease of doing business. So we just discussed about how private sector can do a lot of more investment in Indonesia, and we're talking about not just the supply but also the demand. So talking about collaboration. So how can multinational companies like AstraZeneca can do better collaboration with the Indonesian government and local pharmaceutical players in improve patient outcomes and in boosting the health sector in Indonesia?
Again, I would like to recognize and appreciate the healthcare transformation program, because those pillars are truly will help to transform the healthcare, will also make more patients to better diagnose, treat it, as well as access to the medicine. So that's truly, I think, transformative. The other thing we are doing, and thanks to BPOM as well, right? As AstraZeneca, we are trying to bring every medicine as fast as possible, whatever available across the other reference countries, and thanks to the accelerated pathways that BPOM is trying to put, and we are also trying to bring also suggestions, working collaboratively, and now we are even working with parallel submission, right? How we can make parallel submission to the similar to, for example, some countries like Australia, to make sure that we can accelerate further. Also, one is how we can make those medicines, innovative medicines, as fast as possible to Indonesia. The second pillar, how we can make sure access to those medicines as fast as possible. So we are also doing the cost effectiveness studies, whatever the requirements based on the regulations, to make sure that we bring those innovative medicines to Indonesia, prove that our medications provide better outcomes by evidence on the conventional therapies that is available use, so that we impact the lives, we impact healthier people, and we believe also healthier people meaning healthier economics. That will also fuel the growth of Indonesia.
Okay, thank you so much, very appreciated. Baik, kita berikan apresiasi dulu untuk narasumber kita, dan Ibu Rizka harus melanjutkan untuk tugas selanjutnya. Terima kasih Ibu. Ada mungkin terakhir yang ingin disampaikan atau memang sudah buru-buru? Oke, baik. Baik, kita berikan apresiasi, terima kasih untuk Ibu Rizka sudah bergabung, dan saat ini ada tugas lainnya. Terima kasih Ibu tentunya. Baik. Kita akan melanjutkan sesi diskusi, mungkin sekali lagi ya saya akan tanyakan ke dua narasumber kita sebelum kita membuka sesi Q&A atau question and answer. Baik, saya akan ke Pak Dokter dulu ya, Dokter Selamat. Nah mungkin tadi apa yang bisa diimprove juga, kan tadi dari private sector kita sudah sedikit gali dari sisi ease of doing business, dari sisi apa yang perlu kita improve begitu, dari mungkin tenaga medis sendiri apa yang bisa menjadi masukan-masukan juga kepada pemerintah dan kita bersama begitu sebagai kesatuan untuk stakeholder untuk bisa meningkatkan sistem kesehatan kita lebih baik lagi.
Terima kasih. Sebenarnya ini kan satu rangkaian ya, sangat gampang sekali untuk meningkatkan belanja kesehatan. Karena belanja kesehatan kita kan salah satu terendah di ASEAN. Misalnya tadi Pak Menkes sudah menyebut salah satu belanja kesehatan unsurnya misalnya BPJS. BPJS sekarang sampai 165 triliun misalnya kan, 165 triliun. Hitungan ID itu pembiayaan 165 triliun itu pada taraf 50 sampai 60% dari real cost gitu loh. Andekan itu ditingkatkan menjadi 200 atau 300 triliun kan otomatis marketnya jadi ada. Obat, alkes, termasuk tenaga medisnya juga akan meningkat. Jadi unsur pembiayaan anggaran dari pemerintah itu sangat menentukan sekali, termasuk dengan SDM kesehatan. Mau kita, tadi disampaikan Bu Dirjen, kita bisa produksi bahan baku itu kan hanya ngambil dari impor. Kalau belanja kesehatannya hanya segitu-segitu aja ya segitu. Hanya ngambil yang tadinya impor, kita tidak usah impor. Intinya adalah bahwa membangun kesehatan ini akan baik kalau sistem kita akan baik dan pembiayaan baik. Jadi kami nilai kalau kan promotif, preventif, kuratif, rehabilitatif. Kuratif, rehabilitatif itu ditangani oleh BPJS. Ini akan baik kalau BPJS-nya sehat. Sehat itu adalah pembiayaannya akan baik. Gitu. Katakanlah sekarang pembiayaan BPJS hanya sekitar ya 50-60% dari real cost harus ditingkatkan. Paling enggak mendekati 80%. Kalau urusan SDM yang lain itu ngikut semua, ngikut dari pembiayaan gitu. Akan tetapi walaupun anggaran kesehatan kita besar, kalau alokasinya tidak tepat juga tidak baik juga. Sehingga intinya kami berpendapat